I invite Dr. Manohar Puttanna to tell us about communication goofups in the OPD, and he will also take another topic. Yeah, continue about.
If you have been harmed in a hospital as a result of miscommunication, learn more about your legal options. We offer a free consultation and can answer any questions you have. Please contact us today to set up an appointment. This was an advertisement in a newspaper agency by a legal firm. So even if you give a free consultation to your patient, and if you miscommunicate, and if you by your miscommunication, if you harm the patient, then you are liable. So just wanted to highlight that miscommunication is not a joke. You have to be taken it seriously. So good morning, everyone. My topic today is communication goofups in OPD. We know that the doctor is a key indicator of the health of the patient. So in OPD, we come across different type of people where we talk to the patient, we talk to the attendant of the patient, we talk to our staff, we talk to our colleagues. Sometimes there will be VIP patients, various organizations will come to the OPD, and sometimes for physical fitness, we'll have government officers. So in all these situations, while communicating, we may have miscommunication, which will be spread. So there are mainly, as ma'am told, 3 basic communication, that is verbal, non-verbal, that is the eye contact, facial expression, and your body language, and your sign, and writing. So of verbal, the most important in verbal is your listening. So verbal doesn't mean that you have to talk. As Vidya Balan says, it's entertainment. It's here, listening, and only listening. So there are some basic rules. Patient has bought up your time. Whenever patient pays for a consultation, we think that patient has paid us to give an advice, but it's a misconception. Patient has paid us because he can tell his problem and he can get cure for it. So what our job is, we have to sit and listen to the patient, never interrupt, ask him to speak whatever he feels. And during the examination, never comment negatively about your professional colleagues. So there is a story here, like I was working in another hospital where I had done left eye cataract surgery, and the patient had come to my new hospital, where I was telling that I just wanted to be good to the patient, and I wanted him to do surgery by me. So I told, like, your left eye is not a very good surgery done by the other surgeon, but I will promise that I will do your right eye surgery very well. Then I just asked, where did you underwent your surgery? Then the patient remembered me. I had only done his surgery in another hospital. So he showed, sir, you had only done the surgery. So talking about your professional colleagues will misfire you. So never misfire never talk anything negatively about your professional colleagues. See, the miscommunication can happen within or beyond. That is, it can happen within your consultation room or beyond your consultation room. So usually every hospital has this setup. There is a registration counter, there is a refraction room, and then the patient will come to your consultation room, and there is a counseling section. So at registration counter, there can be a miscommunication. Whenever there is an emergency case of ocular trauma or it comes, patient may be referred to cornea department or retina department or to the orbit department. Thereby they'll be wasting the time of the patient, because time is very precious. And in refraction room, there can occur that usually the refractionist are the white coat bearer other than doctor, and patient will have a very good impression whatever the because refractionist is the first contact, whatever he tells, the patient listens to him. Even after coming to the consultation room, if you tell them you have a cataract, he will never listen, because refractionist is already told that you need only glasses, there is nothing else. So they won't believe that even if you tell there is a cataract, patient will never believe. So first impression is always very important. And in consultation room, there can occur plenty number of miscommunication. You will have OPD assistant. Sometimes your OPD assistant or the nursing assistant will be over enthusiastic, and in the time of the patient load, she may dilate the patient without asking the doctor. So by this, what happens? You will miss lot of signs. You will miss your pupillary reaction, which is very crucial for diagnosing a patient. And sometimes there will be intraocular pressure raised because of dilating without seeing the angles or the intraocular pressure. Sometimes what happens, like each department has its own miscommunication. So I was, once I was given this topic, I spoke to all the colleagues, like what happens in your practice. So I was speaking to one of the retina specialists, Dr. Giraj. He was telling, like, after seeing the patient, patient had diabetic retinopathy, he examined everything, and patient told, sir, what is the condition of my other eye? And then they realized that other eye was not dilated. Okay, again, you have to put the drops, you have to wait for another 1 hour. So there is a time waste. And I was speaking to Dr. Deepthi, what is what happens in your practice? So she tells, like, treating amblyopia therapy, explaining to the patient is very, very, very difficult, because we can't use medical jargons there. Patient will not understand. So she told, like, very easy to give like what happens to amblyopia, how to treat. Even giving in spite of explaining the patient always closes the normal eye, and they closes the abnormal eye, and they keep open the normal eye. So that doesn't work. So again, there is a miscommunication. Again, it depends on the education level of the patient too, how well they understand the situation. And in cornea department, I was talking to one of the doctor, like giving patient hope, that is, patient expects, even if you do little bit, patient always expects a lot. A case was operated for a therapeutic keratoplasty, and patient was kept on asking, when will I get vision, my vision, my vision. So while doing surgery, before surgery, preoperative, we have to give a very good instruction that we are doing only to save your eye, not for your vision. Later we'll take care of your vision. So all this might happen. And in counseling, and special situations like in our part of practice, we'll have people with same names. Example, Basuraj or Mallikarjun or Krishna. Krishna Prasad sir is not here, so I'm taking his name. So Krishna. So this is commonest name. And sometimes for your misfortune, like 2 or 3 patients with same name comes next. Yeah, there will be like series of Basuraj coming. And I always tend to give prescription to the other Basuraj or other Krishna. So this has happened so many times. So you should be very careful while whenever there is a patient with similar names. Now at least we have his IP numbers which we can trace, and we can be very careful before giving a medical prescription or an optical prescription. And in counseling room, again, there are a lot of miscommunication. Like whenever there is a patient going for premium lenses, their expectation is very huge, especially case of mature cataract where we are not able to see the fundus, and patient is going for, let's say, panoptics, and his expectation is very huge. So explaining such patient is, you need a real communication skill. So your soft skill should be very accurate. You may be a gold medalist or you may be a very good surgeon, but your communication solves your 90% of the cases. So So talking to the patient is very important here. So once it happened that next day post-op day 1, patient start, like his vision was 6/6, everything was all right. I was very happy, but patient started crying. I told like, what happened? Why are you crying? Surgery has went well. He was a 50-year-old patient, and he kept crying because he couldn't see the near vision. He was an accountant, and he wanted to report to his office as soon as possible, and he was unable to read because we had put in monocular vision, a monocular intraocular lens. So giving a very good counseling regarding like what type of lens which patient needs is very key here, so that patient will be very satisfactory post-surgery. So what happens whenever there is a breakdown in communication? This will lead to poor continuity of care with you, delayed diagnosis, or a polypharmacy, unnecessary testing, and leading into decreased quality of care. So impact will be, there will be creation of confusion and panic at the both ends. Both patients and doctors will be confused, and there will be dissatisfaction by the patient, and there will be a negative effect on the standard of healthcare, and patient may switch hospital. So 4 things to avoid miscommunication, that is listening, talking, writing, and get rid of your assumption. So assumption is another one very big area where a lot of people, like your OPD assistant, may assume things, what you are telling, what doctor expects. So prevention is better than cure. That is, checklist is needed, and training and classes should be taken for your OPD assistant, for your DNB or your fellows. And as I told, doc is the key indicator for evaluating quality of services, and whatever you do should be a patient-centered approach. So what a good communication can do, it makes all the difference. Trusting your judgment, it improves patient satisfaction, attract participation, and it follow the recommended treatment. Finally, a feel-good hospital experience with successful outcome is what patient expects from us. So take-home message is triage, that is prioritize the problem, tackle the complaint, and as madam told, we are very restricted to only 2 words for us. So instead of that, treat the patient as a whole, not just the complaint.